Contrary to popular belief, bipolar disorder does not really mean two people living inside one body, two souls, one body. None of that. It doesn't mean that there's a Tom and Harry inside a Tom, or that there's a snake and human inside a human. No, that is ridiculous. That does not happen. And if that would happen, well, that is what I call supernatural. Like most other mental illnesses, bipolar disorder is one of the most misunderstood illnesses of all time. I mean, literally, the information is out there. It's just a Google search away. But still, people seem to have a lot of misconceptions about what exactly this disorder is. Recently, I met someone who was suffering from a bipolar disorder, and when I got in talking with her, I realized after she told me how a lot of people have ridiculous views about what exactly mental illnesses are, and hence this video. So yes, let me break it down for you right now. First and foremost, bipolar disorder is not a personality disorder, it is a mood disorder. Bipolar disorder involves dramatic shifts in emotions, moods, and energy levels, and these shifts occur over days to weeks. So there are times when the same person can feel so depressed and can have all those negative emotions like sadness and irritability and loss of interest lining up, and the same person at a different point of time can also have an episode of mania in which the person might appear to be hyperactive or vigilant, and might have a lot of what we usually call as positive emotions inside him, but all of this occurring in the same person at different points of time. The maniac episodes usually last for more than 1 week, and the depression episodes may last for about more than 2 weeks, and both of these should be present at different points of time. There are something called mixed episodes in which the person experiences mania and depression at the same point of time, and well, that is a rare phenomena, but yes, it is also a part of the spectrum of bipolar disorder. Now the question is why bipolar disorder develops in some people. Now there are a lot of theories about it, and all the theories, however, equally correct. No theory can pinpoint that this is the reason why it occurs in all 100% or at least 90% of the individuals in which it is occurring. One theory is the genetic theory, which says that if there is somebody in your family who suffers from a mental illness or has a bipolar disorder, you might also be at risk of developing it. Second theory is that of environmental conditions, based on the social and economic environment and other aspects of our surrounding environment. Some people are more susceptible to it as compared to others. Then there is the biological theory. Something wrong with your neurotransmitters and hormones can also lead to this condition. Psychological theory. Some individuals are more susceptible to others because of their own personality traits, because of their own experiences, because of their feelings, because of the differences in which different people react to the same condition given under the same requirements. And in some cases, even though the diagnosis is clear, there might not be a definitive cause that people could point out to, that yes, this is why this has occurred. So yes, it is an intermingling of all these theories which leads to a person developing bipolar disorder. So quickly talking about what can be done. If you think that you or somebody else who you know might be suffering from a bipolar disorder, here are the things which you can do. Number one, consult a psychologist or a psychiatrist. The various options that would be given to you are psychotherapy, wherein you will work together in tackling this condition through therapy and using other behavioral techniques. There are certain medicines available which obviously you should not take without a doctor's advice ever. These medicines have a lot of side effects which you do not obviously know how to deal with, and even if you do, it is not advisable to take them on your own. And last but not the least, which is always the most important part, to be honest, is talking about it to somebody you trust, somebody you think who could guide you in the right direction as to what should be your next step if you think someone or yourself is suffering from something like that. I hope this video made a few doubts really clear about what exactly bipolar disorder is, because clearly we have been misguided. Thank you so much for watching. This is Pavitraa Shankar signing off.